Hello dentist, how are you today? Today we're going to talk about the causes of intrinsic discoloration. Before we start our topic, I want you to subscribe to my channel and hit the notification bell for more videos. Okay, what are the causes of intrinsic discoloration? It could be due to, first cause could be due to trauma. Trauma if a tooth is hit, okay, in any object, okay, or any student falls and hits his teeth, okay, it will result in the pulpal death. So what will happen to the pulp? It will die. Can you see now what happens due to trauma? Okay, the tooth will extrude out of its socket, okay, will come out. Can you see it's extruded out of the socket, and it's, can you see the difference? Okay, and there is hematoma here, hematoma, okay. So this is the first cause of intrinsic discoloration, and then starts due to pulp death. What happens? The tooth starts to change its color, becoming yellowish brown. Okay, fluorosis is the next cause of intrinsic intrinsic discoloration. Fluorosis. Tetracycline staining, okay, also is an intrinsic discoloration. Amelogenesis imperfecta and dentinogenesis imperfecta. Let's go and see the slides. Here, trauma. Can you see here after a few weeks or so, what happens to the tooth after it's being hit or it's hit by any object, okay. It will change its color, okay. Can you see it's a little bit brownish yellow, okay. So what do we do in this case? In this case, we have this, if it happens in primary tooth, we will extract the tooth, but in case of permanent tooth, we will make an endodontic treatment, okay, to save the tooth. In case of fluorosis, is a common disorder characterized by hypomineralization of the tooth enamel caused by ingestion of excessive fluorine during enamel formation. So when we take more fluorine, a lot of fluorine during the formation of enamel, what happens? This will lead to a change in the color of the tooth, will lead to formation of dental fluorosis. This is called dental fluorosis. Can you see the white patch here on the tooth? Okay. Amelogenesis imperfecta is a congenital disorder, okay, disorder of which presents an abnormal formation of enamel or external layer of crown of teeth, unrelated to any systemic or generalized condition. So here, this is how it looks like. This is we call it amelogenesis imperfecta. So it's a congenital disorder due to abnormal formation of enamel, or external layer of the crown of the tooth, which is unrelated to any systemic or generalized condition, okay. This is how it looks like. This is called amelogenesis imperfecta. Dentinogenesis imperfecta is a condition characterized by which teeth that are translucent, and discolored, change in the color. Can you see they are translucent and discolored? They're a little bit darker, bluish gray or yellowish brown in color. Individuals with this disorder tend to have teeth that are weaker than normal, so their teeth are weaker than normal, which leads to wearing out of the teeth, can you see, and breakage and loss of teeth, and they break down, and finally the teeth are lost. Can you see there's a radiolucency here in the lower incisors, 4 lower incisors. How to improve the aesthetics of discoloration? What's the treatment, or how do we improve the aesthetics? Methods requiring preparation. So there are two ways to improve the aesthetics of discolored tooth. Could be by preparation, or another method not requiring preparation. Okay, let's know the two methods now. Methods not requiring preparation, like veneer, making a veneer or a crown. Okay, we can prepare the tooth for crown or veneer. Methods that do not require preparation, if we don't want to prepare the tooth, what can we do? We can do bleaching, okay, or composite veneer. So this is this is really important to know what can we do to a patient coming to the clinic with intrinsic staining of the teeth, and we offer him the following treatment plan. How to remove the intrinsic stain, from a tooth surface. So if a patient coming to the clinic with extrinsic stain from external, not an intrinsic one, what do? We polish the surface with pumice slurry and water or prophylaxis paste. The second choice, we use an ultrasonic scaler. Could be removed with an ultrasonic scaler or cleaner. And the final method for removing the extrinsic stain is bleaching. Okay, we can do bleaching. So there are three methods for removing extrinsic stain: polishing of the surface with pumice and water, or prophylaxis paste by using the paste with the brush, okay, using a slow speed. And then here we can use an ultrasonic scaler or a cleaner, okay, to remove if there are stains, external stains could be removed with an ultrasonic. And the final method is bleaching, okay. Thanks for listening to the lesson, today's topic, and I want you to subscribe to my channel, hit the notification bell for more videos, and I hope it was of interest to you. I'm sure it's going to help a lot of dentists in the clinic, and keep up revising all the time in order to be a distinctive dentist. Thanks for listening today. Bye.